I'm Michelle, and I'm here to do a facelift, neck lift, and I think a chin tuck. I just want to refresh. I'm in a stage in my life that I just want to refresh before I need it. I'm excited, so we have a little bit of a review today, so it's going to be fun. Nervous and excited.
What are you nervous about?
Going under the knife, I guess. It's a little bit always of a question in my head. I've been thinking about it for a little bit, so over a year. And really what stopped me really has been that, you know, because you still go, it's invasive, you know, into your body. So that's really what stopped me, but I'm very comfortable with you. Dr. Maercks just gives me peace. You know, when I sit with him, I trust him. I like his procedure. He has a unique procedure where it's less downtime, and for me that's important also. But more importantly, I just sit with him. I think every patient is different, and for me it's a one-on-one, and I just feel very comfortable with him. I also like his practice. If you do research on him, the way his technique is very aligned with what I want, the deep plane and the way he lifts up the muscle. He's very, very well diverse in the anatomy of the face, and you know, you do your research and every surgeon is different. I'm very comfortable with his procedure.
Today we're doing what's affectionately referred to by my staff as the trifecta, which means it's really the Maercks lift, what we call the Maercks lift, which means musculo-aponeurotic retention with check cage suspension, which is kind of like my take on a deep plane facelift, but we're doing kind of all the stops. So we're doing the deep plane support, which gets the mid face and everything up, and the monoblock concept, which means that when I take this up, I kind of leave the neck muscle connected in a very special way that allows it to mobilize significantly and come in a natural way with the face. And then we tighten the neck in a different vector, kind of like opposing vectors that really get that snatch jawline and long-term support. And we're also doing the third component, which is the submental lift, making an incision underneath the chin, taking out the fat, but most importantly, tightening the deep layer and the superficial layer of the muscles, so we really get that kind of articulated angle of the jawline. And then we are adding in what we call aesthetic facial balancing, which is hyaluronic acid-based fillers with a few main goals. Temporal filling, lifting the high area around the eyes to make it blend with what we're doing down here, and then really cool kind of a liquid rhinoplasty. So the nose goes backwards with facial aging and the cheek comes forwards. All this stuff we're doing is elevating and retaining the cheek and all this nice healthy volume in a youthful position. And then we're also gonna push the nose forward to correct that sinking back. We have bone resorption here, we call the base of the piriform aperture, or the hole where your nasal airway is. So bone loss and tissue loss there makes your nose go down and back. So we're gonna counter that and push it forward and up, making a completely balanced rejuvenation. So stick with us and we'll take you through it.
I'm excited. I'm excited. You make me excited. He makes me excited. I'm super excited. Now I'm super confident. Now I'm like, let's do it all.
I love it. We got it. We're going to make magic happen.
Yes, absolutely. We are ready.
Move in. Why not? We like you here.
Am I going
yeah, head goes this way, feet go this way. And Melody's going to help put these fancy things on. Our little massagers. So we just finished one of today's facelifts. Again, we did the trifecta, or the Composite Deep Plane Maercks lift, which pulls up everything as a monoblock, very naturally beautiful. And then we embellished that with that lateral traction platysma, and really important in this case, it went beautifully. Surprisingly, the patient had a big blanket of fat superficial and a big nugget of fat deep, so taking that out and really tightening up those muscles really just added so much dimension to this case. And and then the little details, we did some nasal rejuvenation as well, or liquid rhinoplasty. I call it nasal rejuvenation in this case because really everyone's nose goes backwards in the face and down. And this patient had some lack of support in the mid-dorsum, as well as that typical descent and downward tip rotation. So I rotated the tip back up, pushed the base forward, and then gave her a little bit of blending of the temples, brows, and high malar area, because we didn't do anything to the upper third of the face, so to make it all match all the beautiful stuff, and then incredible sharp neckline. I mean, this neckline goes in 90 degrees down. It's really gorgeous. The neck areola that you see is ocularly, we're developing hollow. With each suture, see how that further defines the neck shape, even the jawline. This is what I talk about so much with proper composite deep plane facelifting. 90% of the lifting, 89% of the lifting is done with what I call the composite monoblock, because I have not tightened the neck yet, but look how tight that neck is. You see that? And the skin's loose. So everything went great. So the trifecta and a little aesthetic facial balancing, and we'll take you through her recovery. She's just woke up like this, of course, like most of my patients, or all of my patients, really pain-free upon wake up, just having a normal conversation, like nothing happened. I asked her, has it been 3 minutes? She's like, yeah, about 3 minutes. So I tell patients it's gonna be 3 minutes for you, 3 hours for me, and we're done. And there we have it. I love it.
I really feel great.
I love it.
I am so happy that I did it. I thought it was very, he's a perfectionist. I love the fact that he took multiple pictures to perfect it, even though it took a little longer, but I think that's brilliant because he's a perfectionist and it gives me comfort, that part. Obviously the heating, they put a heating thing, the vest, the garment was wonderful because it keeps you warm inside. I felt very comfortable during the whole process. It was a smooth, for me it was a shut of eyes. I guess for the doctor was longer. I just want to know for the weekend, that's all.
This is cool, you can see in 3D pictures.
It is so amazing. Like I see myself there and I feel like 20 years younger. It's so crazy.
Yeah, that's not you.
When I first came, the doctor gave me his consultation, of course, and from the beginning, I just felt so comfortable with Dr. Maercks. And honestly, I am in shock of how tight, wonderful. I love the outcome, exceeding my expectations totally. And I'm so happy with the procedure, and I'm so happy that I took the leap of faith, because right before surgery, you get a little nervous and whatnot, but it was wonderful. He's been wonderful throughout the whole process. And I'm in shock that you can feel this good 18 hours after a surgery. That is very impressive. It's his technique, it's the way he does the facelift, and he has a technique that I wasn't sure it was gonna be this painless, to be honest, and it's been wonderful, like truly wonderful. So I call him Magical Hands, of course, now.